Hello, everybody. I'm going to get started now. It was a little bit difficult for faculty to get into the Zoom, but with Kimberly's help, I was able to. Hope everyone's doing well today, whether it's your early morning or whether it's your evening, depending where you're calling in from. Join the meeting. And I'm joined by Kimberly Bale, who's the Deputy Director of GloCal, and also the program manager, as well as Mariah Coley, who's a twice alumni, is going to be presenting after I give a brief overview. I also see Teresa Kortz, who's also faculty and co-lead with me at UCSF, has joined. I'm looking to see if there are any other faculty at this point. There might be faculty from our international partners. I don't see from University of California. So I'm going to give a brief overview, PowerPoint presentation, and then we're going to have Mariah Coley give a presentation from the recent fellows perspective, and then we'll do Q&A, which is usually the funnest part. So I'm going to share my screen. Okay. There we go. All right. Okay, so I'm going to give you an overview of the University of California Global Health Institute's GloCal Health Fellowship, which is really to support aspiring both domestic U.S. and international trainees, excellent opportunity for training in global health research. So the program has been in existence since 2012. We're one of the original five consortia that were funded back at that time. So we're in our third iteration. We'll be entering what you would, if you're successful with your application, you'd be joining us in year 15 of the program. We're one of 7 programs that have been funded by the Fogarty International Center at NIH. And to date, with the cohort that has recently started in July, we have had 208 fellows throughout the program in the first 14 years. This is just a review of the leadership. We're all available to consult with you and discuss with you, along with Kimberly Bale. So myself and Teresa at UCSF, Jay Lee at UCLA, Beatriz Martinez Lopez at UC Davis, and Natasha Martin at UC San Diego. These are the 4 primary UCs that are involved in GloCal. But we are UC wide, meaning that if you're affiliated with any of our other campuses like Santa Barbara, Santa Cruz, Riverside, etc., you can also apply, though you also need to have a mentor from one of the 4 primary UC campuses as well. So the main focus of GloCal is really to provide support to you through a stipend and research support to support your research for a 9 to 12-month period of time, hands-on research, whatever that may be, anything from basic research to implementation science and beyond. Mentorship is a cornerstone of the program. We believe in and I'll talk more about this, in the value of having a mentorship team of individuals who represent different aspects of your career and of the skills that you want to develop throughout the program. We have an educational component with primarily virtual courses that are available to you. A career development component led by Jay Lee, where we have leaders in global health across various spectra and in different fields present to you. And for our fellows who come from low and middle income countries, a requirement is to spend 1 to 3 months of your time with your primary at the campus where your primary UC mentor resides. Okay. In addition, we offer a certificate program in partnership with Cayetano Heredia Universidad Peruana. This is led by Willie Lascano and Natasha Martin. Have created this certificate program that if you complete a course in Designing Clinical Research, which is an online course that's offered during the summer months at UCSF. We have didactic sessions. We actually have faculty affiliated with GloCal around the world that provide these 8 sessions. They're really excellent. And then you need to document that you've met with your primary mentorship team, and then you can earn a certificate in global health. So we work in many different regions with a significant emphasis in Africa, specifically Eastern and Southern Africa, although we also have a great partnership in Cameroon and Ghana in more Central and West Africa. In Asia, where we work in Chiang Mai University in Thailand, in India, St. John's Research Institute, and in Vietnam, in Hanoi Medical University. In Latin America, we work in Ecuador, Peru, and Bolivia. So if you are planning to work in any of with our partner institutions in these sites, that's great. Or if you come from these countries and have an affiliation or can develop an affiliation with our primary institutions in these countries, then that makes you eligible potentially. Okay. Speaking about eligibility, so we have different fellows that come from different backgrounds. We have spots reserved for U.S. postdocs, and that comes from our funder, Fogarty International Center. If you're a U.S. postdoc, then obviously you can apply to this program. You can be someone who's going to be finishing residency this year, has finished residency. If you're a physician, you could will finish by June your PhD or PhD equivalent. You're eligible for this program. And then we also have postdoctoral fellows from our partner institutions. So again, you need to have a doctorate. And for those of you from Africa, an MBCHB, which is essentially equivalent to an MD in the US, makes you eligible. Although the caveat is if you only have an MBCHB and don't have a master's, either an MMed or an MPH or some other degree in addition, you're not going to be very competitive. And then we also from the US take senior professional students. These are MD, dental students, veterinary students, PharmD. And then lastly, we take advanced doctoral students. Predominantly, it's been students who are working on their dissertation projects, which is being conducted internationally. And they have to be from this is the one caveat, they need to be from one of the 10 UC campuses in order to apply, and a US citizen or resident. For the US postdocs, we can recruit you from any institution. You have to be a US citizen or resident. GloCal is very or transdisciplinary. We've had people from all of these disciplines and beyond successfully apply to GloCal. I remember we had an oceanography student in our first cohort who ended up working in Panama she was scuba diving to collect cyanobacteria, which potentially could produce potent anti-cancer medications. So her background was oceanography combined with public health, and she had a very interesting project. So as far as the selection process, there's a steering committee that does the initial review of the written application. As you know, the applications are due September 15th, with all the components been submitted by that time. These steering committees comprised of members of all 10 UC campuses and our international partners. Not all of our international partners, but several of them. And then those that get shortlisted are then asked to come for an interview. It's usually about 50 to 60% of the applicants that we get that are invited for an interview. Those interviews they're team interviews, which are comprised of 2 steering committee members and at least 1 person from the leadership group. So there's 3 people. And then the leadership group makes a final decision based on the final scores after the interview, the applications, as well as we have various funding streams that are coming in to support the GloCal Health Fellowship. And so we have to make funding decisions based on that as well. Um, we get funding from the Fogarty National Center, and specifically, we get significant funding from the Office of AIDS Research. So it has to be high priority HIV research. In addition, we get money for non-HIV research from Fogarty as well. So that means you can apply to do anything. There may be some advantage if you're doing HIV research just because of the number of applicants we get and the amount of money that we have focused on HIV research. In addition, though, the whole alphabet soup that you see on your right, NCI, NEI, and so forth, those represent the other institutes like National Cancer Institute, National Eye Institute, that have and can supply additional funding to support your fellowship. So this is a process that happens in our usually somewhere between February and all the way up till June, where these institutes are reviewing top applicants that were not funded in the core funding and provide additional support. So if you know what your research is focused on, then you should look at these institutes. Like, for example, if you know you do cancer research, you should look at the NCI website and go to the Global Cancer Program and see what their priorities are. And then see if your research fits within there, or if you could make it fit. That would increase your chances of funding. Similarly, with all of the others, NEI, National Eye Institute, National Heart, Lung, and Blood Institute, National Institutes of Aging, and so forth. So that's something you can do strategically with your mentorship team. And below the alphabets that start with O, those are offices, Office of Behavioral Science and Social Research, and some of them I don't even know. So you can also look at those offices. Some of those have also funded our fellows too. Okay. So this is just giving you a kind of an idea of some of the fellows that we've had. You can also go to our website. We have all of our alumni are in the various cohorts by year. Um, and you can see what their primary research has been. You can also reach out to them too if you have specific questions. So Vanya Wang was a doctoral student in geography at UC Santa Barbara. And she worked in Malawi, and now she is working at the U.S. Census Bureau. Huan Dong was a medical student at UCLA at Drew University, looking at antibiotic resistance in Vietnam. He's now a pediatric infectious disease fellow and very engaged with us at GloCal. He's been a big supporter of future cohorts of GloCal applicants. So if you have any questions about Vietnam or about being a GloCal fellow when you're a medical student, he would be a great person to reach out to. John Rose was in one of our earlier cohorts, general surgery resident out of UC San Diego and worked in Mozambique. He's now an assistant professor in plastic and reconstructive surgery at UCSF. Chimtai Mungo was a mentee, still is a mentee of mine. She was she was funded at UCSF on a T32 training grant after finishing residency as an OBGYN. And then we funded her for one of her 3 years of her fellowship. So that's possible. If you're funded on a T32, it's possible to get co-funding from GloCal to support your research in an international setting. She's focused on cervical cancer prevention among women living with HIV in Kenya. She's originally from Kenya. She's a US resident. She's an assistant professor and doing extremely well at UNC Chapel Hill. Henry Sawe was in our second cohort, a postdoc from Muhimbili University of Health and Allied Sciences in Tanzania. He's an emergency medicine physician. He's now the executive director of the Abbott Fund in Tanzania, essentially charged with developing an emergency medicine system for the entire country. He gave an amazing talk at the GloCal orientation in July. It got a lot of buzz. And then he's also our site PI for GloCal for Tanzania, for MUHAS. Larissa Otero was a postdoc from Cayetano in Peru, focused on preventing tuberculosis in children. She's an associate professor, and she received the K43, these career development awards. K43 was a new mechanism to fund international scientists for a career development award, and she was the first person to get a K43 in all of Latin America. and she's on our training advisory committee. Okay, mentorship, as I mentioned earlier, is really the cornerstone, the foundation for which you will be successful with applying. You should be working with your mentors early and often to help develop their applications. And then having that and developing that relationship over a year, hopefully longer, is really the cornerstone for you to build your career, both early and even later as well. So it's required to have, as I mentioned earlier, you need to have one co-primary mentor from one of the four original campuses, Davis, LA, San Diego, and UCSF. You need to have a mentor from your the site where the institution where you're going to be working in whatever country it is, maybe the institution you belong to, or the institution you don't have to be at that institution in order to apply, but you need to have a mentor from that institution. Um, and then you also need to have at least one additional mentor, like a co-mentor, usually a senior investigator, usually from a different field, but can complement the mentorship team that you have, provide extra skills and support, and career development advice as well and support. So the expectations of the mentor, we really want you to work with your mentors for at least a month, if not longer. I mean, the longer, the better your application. I know that for some of you who are applying from other countries, to identify if you don't already have a contact at the University of California, finding that UC mentor is not always easy. And Kimberly and I and the other faculty leads are here to help you to identify that person. There are tools on our various websites called profiles, which I'm not going to go into right now, to help you identify people who work in your field. But sometimes emails go unresponded, and that's where the faculty leadership and Kimberly can help you make those contacts. And then we expect that you're at least having monthly contact with your mentors, and that the mentors will assist you throughout the year, but beyond, right? Because you won't finish your project, you will not have published your papers and those sorts of things during that 1 year. Hopefully you'll publish, but there won't be the results of your primary research by then. Okay. So tips for a successful application, we have on our website discussions about the application process. We also have samples of successful applicants. So you can take a look to see what's been done. And you really need to have the mentors review your application before you submit it, because that is what's going to define your application, and determine whether or not you get accepted or not, or shortlisted or not. And then the mentors need to send their letters of support, and their NIH bio sketches by September 15th. So it's all part of the packet that gets reviewed by the Scientific Advisory Committee. As I mentioned earlier, GloCal is one of 7 consortia that's been funded by the Fogarty International Center. We collaborate a lot, and we have ever since the initial phases of this program, which is called Launch, by the way, if you're looking at other programs. I should mention that too, that you only can apply to one program. I know there's 7, and you may be eligible for more than one. There may be in some countries like Peru and Kenya, all 7 operate. I think it's all 7 operate. So you could apply through any of them if you're from that country. So you only can apply to one, and the program managers check to make sure there's no duplicates. So that, and then we also we have an orientation, which is one of my favorite weeks of work during the year. It's usually the second week of July. This next year, it's going to be the third week of July. We have professional networking, and also we've had regional scientific meetings, first in East Africa, Southern Africa, and Asia. So those will be continued. Those are open to trainees from that region, and alumni from any of the consortia. So anyway, you know about the website, I assume, otherwise you wouldn't be here. Kimberly is the source of all information. She gets overwhelmed, so also use the faculty contacts as well. I'm here, Teresa's here, and then the faculty from UCLA, Davis, and San Diego also available to respond to your emails. Okay. So rather than take questions now, I'm going to hand it over to Mariah Coley.
Hi, thank you. Let me just share my screen. Okay. Thanks, Craig, for that introduction. So, hi, my name is Mariah Coley. I'm currently a postdoctoral research scholar at the Scripps Institution of Oceanography at UC San Diego. And I'm here to share about my experiences with the GloCal Health Fellowship. So quickly, first, just a little context about me and my background. I attended Dartmouth College for my bachelor's degree, and after that, I didn't really know what I wanted to do as an undergraduate, but after that, I worked for a few years as a research assistant and a project manager in agriculture and in food systems for researchers in labs at Dartmouth and then at UC Davis. And in 2016, I started a Master of Science program in International Agricultural Development at UC Davis. And during that time, I got a USAID fellowship to travel to Uganda for 6 months to do field work for my thesis on farm system modeling and decision support for irrigated horticulture in Uganda. So I had a really great experience doing community-based field research in that setting, and I really wanted to do more. So I decided to do a PhD in geography. And I chose geography because at UC Davis, that program is very flexible. There's kind of an underlying theoretical foundation based in kind of principles of geography. But on top of that, for my research, I could create my own kind of integration of agriculture and rural communities and international development that was a great fit for my interests. And I have been, as Craig mentioned, incredibly fortunate to receive two GloCal awards, one while I was a PhD student and another as a postdoc. So in this presentation, I'll step through kind of how my research evolved and the role that these fellowships played in that evolution. What I ended up doing in my PhD research, though, was to focus at the intersection of soil health and human health in rural households in Kenya. And this has also been kind of the launching point for my research and career as a postdoc. So although I still identify as a geographer, with the work I've done during these GloCal fellowships, I have shifted quite strongly toward a more kind of quantitative and computational focus in microbiome sciences. So these are some of the questions that kind of define my identity as a researcher now. So things like, how is the soil microbiome affected by soil and land management? How does our exposure to soils affect our microbiomes, our gut microbiomes, our skin microbiomes? How do those relationships and interactions affect our health? And then what I'm working on now and starting to shift toward in my postdoc is understanding what are some of the mechanisms for those health impacts from exposure to environmental microbiota. So that's where I am now, just to kind of give you a sense of where I've arrived to from where I started. So the GloCal Fellowship has provided a lot of support and structure for me at a couple of key transition points in my career and in my research, and has played different roles each time. So I'll talk more about each of these in the next couple of slides. But as a PhD student, what I wanted to work on wasn't completely within the scope of what my advisor's lab typically did. And there was no existing grant or research program that was supporting me in my work. So this GloCal Fellowship gave me the flexibility to kind of explore the research topics that interested me, even though they were a little outside of my lab group's area. And importantly, it provided some funding to cover the costs of my project, which my advisor couldn't provide through the other grants that she had. So I gained also a lot of experience that was super valuable in leading a research project in an international setting. And then as a postdoc, the GloCal Fellowship played a different set of roles for me, which were less kind of exploratory and kind of finding myself and more kind of to build on the outcomes of my PhD and establish my research identity and portfolio of work, and to generate preliminary data that I can use in future proposals. And it has also helped me a lot with expanding my professional network and has given me opportunities to mentor younger researchers in Kenya, where my work is. And some of those people who are now part of my research team are becoming kind of important members of my professional network. So for me, all of this is kind of moving toward achieving independence as a researcher. And some key components of that are publications that I'm generating from my GloCal funded research, being able to demonstrate that I can successfully compete for funding, and a strong and, as I mentioned, kind of growing international network of institutions and people. So I started my geography PhD in 2018, and in my program and in many others, typically you do a year of coursework followed by a qualifying or a comprehensive exam. And if you're successful, then you move into a phase of like a couple of years of independently doing research for your dissertation. So I passed my qualifying exams in early 2020, but the onset of the COVID-19 pandemic interrupted my plans, and I could no longer go to Uganda to do field work that I had planned. So at this point, none of my research had really connected with human health, and I decided to apply to GloCal to bring that piece in. As a pre-doctoral GloCal recipient, the fellowship really provided a platform for exploring this new kind of disciplinary area that I had never worked in before. And then through the mentorship model, it also provided the support to help me navigate that new area, and provided a year of my graduate student stipend so that I had the time kind of protected to focus completely on my research without having to teach or to work on the side in order to kind of make ends meet. And as I mentioned before, the research funding part of the GloCal award kind of gave me this ability to run the project and collect new data without being kind of reliant on another grant. So my project was located in Western Kenya, where through my GloCal mentors, I was able to tap into an existing cohort of rural households that had been previous participants in another project. So my host institution was and really still is the Kenya Medical Research Institute, or KEMRI, which has provided a really strong administrative foundation for me to effectively do this work. For example, KEMRI staff who have helped me kind of navigate the ethical review process and complying with local research regulations, along with a large local network of researchers and practitioners. So all of that support helped me to very effectively enroll 144 households across that region in my study. And my overarching research question was, what is the contribution of soil microbiota to the gut microbiomes of children living in rural households? So in each household, I collected soil samples, stool samples from children living there, and conducted an extensive questionnaire. And then I did some DNA sequencing with the samples, and was looking kind of at the microbial communities within the soils and the gut microbiome. And there were two kind of high-level outcomes from my analyses. First, that my data were suggesting that there are significant contributions to the child gut microbiome from the soil microbiome, which may be influenced by seasonality and especially precipitation, and that there are variations in the composition and the structure of the gut microbiome that are associated with the specific type of rural landscape that the household is located in. So after my first kind of GloCal year as a predoctoral fellow, I spent another year learning and applying the methods for analyzing microbiome data that led me to those conclusions. In late 2023, I knew I was going to be ready to finish my dissertation by around March of 2024. So I started kind of casually looking around for postdoc positions. And I was really pleased to find that actually one of the PIs whose work I admired, Dr. Jack Gilbert at UC San Diego, was actually recruiting for a postdoc position. So I emailed him and said, hey, I'd like to apply for your postdoc position, but I also want to apply to GloCal. Here's a one-pager describing the project I would do if I get it. If I get the GloCal, will you hire me and will you be my host lab and my primary mentor? And he really liked that. I was reaching out not only to reply to his job listing, but that I was already sending kind of a fully fleshed out project idea based on earlier work I had done, and that I had plans to apply for funding to fund that project. And that I had a track record of success applying to GloCal before. So I got the GloCal award, and in mid 2024, I started as a postdoc at UCSD. So I've just recently finished that first GloCal year of my postdoc, first year of my postdoc, which was my second GloCal award. And in this year, I focused on kind of building on my PhD work by addressing a couple of new research questions, developing a new cohort of households, and learning and applying some new methods in my work. And with this first year of my postdoc, with that support from GloCal, I was also able to generate really important preliminary data that I'm already introducing into new proposals, expanded my skills in mentoring younger researchers. And in this fellowship, I kind of explicitly included a network building component into my fellowship goals, which has really helped me to build new relationships here in Kenya that I think will be valuable for as I move forward with other projects. So looking back at my path, the GloCal Fellowship really supported me at these important kind of transition points. My pre-doctoral GloCal Fellowship was during the third year of my PhD and helped me kind of make that pivot and get my research off the ground again during the pandemic. And I spent a couple of years after that learning and applying the methods and tools to analyze data and finish my dissertation and then apply for a postdoc. And then I was able to leverage my second postdoc GloCal award in the first year of my postdoc to get a strong start in a new institution, a new lab, and generate new data, continuing to build my network. So I've just finished that first year and I'm already kind of working on data analysis and papers. I've put in a couple of new proposals to build even more on this work. And I've been able to get involved in other new projects that will also contribute to my development as a researcher. One of the most valuable parts of the GloCal experience for me has been getting to work with and learn from my mentors. Dr. Kate Scow was my PhD advisor and primary mentor for my pre-doctoral GloCal, and she's kind of brought her experience as a soil microbial ecologist to my work. Dr. Filgona Otieno is a pediatrician at Kemry who provided a lot of great advising on kind of tailoring my study designs to be actually feasible in the context of rural Kenya. Dr. Craig Cohen at UCSF was my kind of transdisciplinary mentor, has spent a ton of time in Kenya and working with Kemry himself and provided a lot of support along the way with pretty much every aspect of my work. And then Dr. Jack Gilbert is my current postdoc supervisor who has really trusted me and given both support where needed and a lot of independence to do this work in Kenya. If there's one takeaway about the value of doing a GloCal fellowship, for me, it was all of the experiences embedded within independently leading my own research project. So in my case, that was having to take responsibility for not only the scientific parts that I had been trained for in my PhD, but also hiring and training a team of research assistants to support my projects, handling a complex project budget and expenses, a lot of complicated project administration, and communicating about the project and its impacts. I just recently had an annual review for the first year of my postdoc from my supervisors at UCSD, and they said, basically, it's so great that you're getting all of this training in these parts because these are the things that often highly trained people don't actually have exposure to before they're kind of applying for assistant professor jobs and kind of at a later stage. So that's a really valuable component of this that I think is really worth getting trained in. The other incredibly valuable outcome for me has been the network that I built in Kenya and beyond. So that includes other researchers who might be collaborators or even potential employers in the future, and also people and institutions who work to support research, like analytical labs or vendors for research supplies and equipment, people who are just very key to actually getting work done in an international context. Okay, so that's, I think, pretty much all I wanted to say, just to give a little bit of a sense of my experiences. But I'm happy to talk with anyone further about this experience and the process of applying and doing a GloCal fellowship. Here's my contact information. Please feel free to reach out at any time. Thank you.